Thank you, Carol. Thank you. So thanks, Carol. Thanks, Dawn. Thanks, Sarah, for the very kind invitation. It's wonderful to have a chance to be here. I am going to talk a little bit, I'm going to touch on some things geographic, as Carol said, but I want to talk more broadly about gun violence in the United States. And I have given this talk a number of times, and in honor of some banter, some email banter that we had back and forth, I put a question mark at the end of the title. And so I'm hoping to go through this a little bit, tell you about sort of the broad stretch of where we are in terms of the tragedy of gun violence in the U.S., and then talk about it as a disease, and is that really appropriate? And perhaps what we might get if we begin to consider it more of a pathophysiologic process and not simply a public health or a justice process. So, I was told nope. Okay. So, little parable. I see him. I got him in the corner of my eyes. I do have the clock. So, in 2010, in the U.S., we had about 310 million people that were born. About 310 million people, 4 million people were born, and about 2.5 million people died. Now, it's the first time in U.S. history where we also had the same number of firearms as people in the United States. However, for firearms, about 5.5 million of them were born, meaning were created in that same year, and only about 100,000 of them died. So firearms are these devices that are designed to last for quite some time, yeah, and their longevity, and apparently their fertility is better than ours, yeah? Now, if you take that out from 2010 and you go forward, from one gun per person in the U.S., this is growing at a pretty rapid rate. Now, I'm not a demographer. In my projection here, however, is coming pretty much to fruition, these linear projections going forward of people and guns in the United States. We now have, and this is a recent report that came out, we now have more firearms than the next 25 highest nations combined. And I'm not talking about military firearms at all. These are all in civilian hands, these firearms, yeah? And we have the highest firearm-related death rate of any developed nation on the planet. So the question is going to become, since we have these firearms that are proliferating and living a really long time, who's got a better idea what to do, right? So today, I want to talk to you about the new idea of the biomedical and public health recognition of firearm violence as a problem in the U.S. I want to talk about the state of the science in terms of solutions, what we know, and then get to this question of, is there value in thinking about gun violence as a disease? Now, this is Paul Reaping and I at Columbia. Paul is a doctoral student of mine who's phenomenal, someone who I hope you all might think about recruiting at one point. But so we did this great piece looking at the difference between states that were permissive in terms of their laws and states that were restrictive in terms of their gun laws. And it's a broad categorization. There are many of these categorizations of state permissiveness or restrictiveness in terms of gun laws. We used one that had never been used before that was created by lawyers in Kentucky that are basically gun rights lawyers. And their scaling of permissiveness and restrictiveness is designed to allow gun owners to travel state to state. So I only tell you that because this isn't created by a gun control organization. So this is very balanced classification of states. And we compared it to mass shootings over the past 20 years. And what you see on average, a permissive state is much higher on average in terms of the rate of mass shootings compared to restrictive states. And very, very unfortunately, starting around 2009 or 2010, the same time when that proliferation of weapons was occurring, when I was showing you before, you see this splitting between permissive and restrictive states. That is, the rate of mass shootings in permissive states and restrictive states is bifurcating, and permissive states are becoming a much greater rate of mass shootings. So this is an issue, and I know the issue of mass shootings has touched Colorado multiple times, and including recently. But I want to talk more about gun violence overall and say that mass shootings, while immensely tragic, as you know, are only the tip of a much larger iceberg of day-to-day shootings in the United States. And those shootings include unintentional shootings, the accidents that happen with firearms, often to children, suicide and self-directed shootings, which I'm going to touch on today, but I'm not going to focus a lot on, but I want to tell you that this is one of the biggest reasons, so everyone talks about the opioid crisis, but the thing just after the opioid deaths in the United States that is occurring is suicide, and that's being driven by gun suicide in the United States, and that's the thing that is now reducing our longevity as a nation. It plateaued it for the first time in quite some time in our history, and now it is reducing it, and gun suicide is very much a part of that, and is growing and something that we should be talking about. But the thing that people also forget is that the biggest chunk of this remains homicide and assaultive shootings, meaning people shooting each other intentionally. The bottom two of these are intentional, meaning the shooting was intended. But homicide and assaults are very much a big problem, a big chunk of day-to-day shootings in the U.S. And when you look at these, the mass shootings, which are, again, I'm not minimizing the important impact of these and that we need to do something about it, but there's roughly maybe 1 to 2 of these a day, whereas for unintentional shootings, there are about 50 a day. For suicide and self-directed shootings, there are about 80 a day. And homicide and assaultive shootings have about 150 a day. The city of Philadelphia 2 weekends ago had 31 shootings. Did any of you hear about it? It was an absolute mass shooting that occurred on a weekend, on a Saturday and Sunday in the city of Philadelphia. So these sorts of things that are mass shootings are occurring on a daily basis, and they're just simply not being covered. Now, what can we do about it? So, of course, the first thing that everyone thinks about when you talk about gun violence in the United States is laws. And that is a legitimate response to what to do. Now, the question does come up. Here's a list of laws. The question comes up, we can keep passing them, but do they work? And what's the science behind these laws? So things like child access prevention laws, right, where there are penalties and requirements for people to store their firearms, and do these work? And do they prevent children from getting firearms and reduce childhood injury with firearms? Is one. Background checks, and loopholes, like the gun show loophole, and universal background checks that are intended. Assault weapons bans have been discussed. Surrendering of guns by prohibited persons. Yeah, so the first 3 or the 2 prior background checks and assault weapons are trying to prevent people from getting guns in the first place in terms of buying them. But what happens once someone has a gun? And again, remember, we have 1 gun per person in the United States. What happens once someone has a firearm? What if they're unfit to have that weapon after a time? There should be opportunities legally to take that weapon away from them. Then there are licensing and training laws. The question comes up, should we be licensing firearms the same way we license someone to drive a car? States across the board are quite impotent in this case, and there's a huge variety ranging from absolutely no training requirements to some minimal training requirements in these, proving that you're able to appropriately use your weapon. We're going to be publishing some more, and Garen Wintemute has a study coming out on alcohol and gun laws. There is a patchwork quilt of alcohol and gun laws in the U.S. It's actually only in 47 states, it is not illegal to possess a firearm and be intoxicated at the same time. So there's some discussion about how can we move that forward. Maybe if you have 2 DUI convictions for driving under the influence, you shouldn't be permitted to have a firearm, and there should be laws that are restricting that. And then gun-free zones. Now, all of these are really interesting legal opportunities, but what do we know scientifically about whether they work? The Rand Corporation did a really nice policy analysis of these, and what we find is the evidence is really good, or as good as we can get it at this point, for child access prevention laws. So these do work. The evidence is moderate for background checks, which is pushing forward universal background checks as an option that, by the way, has bipartisan support. But the other things like the assault weapons bans, surrender by prohibited persons, licensing and training laws, either have studies maybe 1 or 2 studies that are inconclusive on their effect, or have not been studied at all. And I want to get to that in a second. Just the absence of investment in this problem scientifically has left us sort of in the lurch about what works and what doesn't in terms of our legal options. And I will say, when these laws do work, they're typically working, and this is wonderful, to reduce things like gun suicide and unintentional gun deaths. Sometimes assaults and homicides, but the vast majority of the ones when they do work are focusing on, and it's great that they're having impact on gun suicide and unintentional gun deaths. But so legal options are one opportunity, but there are other more local options that collectively might already be having an impact, and we should be pursuing to greater extent for our communities, both urban and rural. And the New York Times had a great piece a few years ago. One of my favorite people, if you ever get a chance to read Emily Badger's work, it's really, really fantastic, the community-based, not just for violence prevention, but for public health in general. So she had this piece talking about the great crime decline. And the great crime decline, we're still in it in some ways. So I don't know if you know it, but crime in the 90s in the United States plummeted in the mid to late 90s and has continued overall in the US to go down. And part of the argument, of course, people are wondering, well, why has that occurred? Part of it is, well, policing has become stricter. You know, I work in New York, and part of it is actually that New York had so much crime. The city of New York had so much crime that went down that helped reduce crime for the nation. But the argument here is that many of these little community-based programs are having an impact. And Patrick Sharkey, who's a sociologist at Princeton, did a piece a couple years ago as well. I think that was partly what Emily was covering here, is where he looked at 264 cities over 20 years. And what he was finding is that for every 10 community programs, homicide and violent crime went down by 6 to 9%. Now, that's pretty impressive. You can imagine in a city like Denver or Philadelphia or New York how many of these little community programs spring up. So they do have value collectively, and we should be thinking about them. And he talked about various programs. And I'm going to talk to you about some of these and from the standpoint of programs that are incentives, carrots, and programs that are sticks, really trying to get in there and disrupt violent activity. And they include things like youth programs, jobs, neighborhood development, and also policing. So one of my favorites is this program run by a group started by Gary Slutkin at the University of Illinois called the Violence Interrupters of the Cure Violence Program. How many of you heard the Cure Violence Program? Yeah, brilliant. If you have an opportunity to Google and see the documentary, The Interrupters, I would encourage you, if nothing else, just watch the trailer. It makes me cry every time. So this is a really fascinating program where they take individuals from the community, many of whom have been in corrections, bring them back out, and use a public health and an epidemiologic model thinking about the gun violence as a disease that propagates and gets spread, just the way an infectious disease would get spread, right, to the EIS officers in the room, yeah? And so they send these folks out to basically interrupt the propagation of the disease. It's a really nice idea. The same way you would send infectious disease epidemiologists into the field to interrupt the spread of some kind of, I don't know, insect-borne disease or something along those lines. You do the same thing here because there's a lot of repercussions. There's a lot of vengeful killings. And if you can get in there and do something. So you can see these guys walk around with shirts they're very well marked and so forth, right? And they will go in and get to know, and they already know many of the actors and perpetrators in this thing, and they will talk them down at the right time. Now, it's been called many different things in many different cities: Chicago, Baltimore, Phoenix, Philadelphia, and New York. Yeah, Cure Violence, many other things. It's had mixed reviews scientifically. The Department of Justice says that it's promising rather than effective, so we need more study of it. And it has shown reductions in shootings, but not in all neighborhoods. So it doesn't always work. And part of the question that I want to get to is it has a high turnover rate. So these folks in the orange shirts will step out often. If the funding runs out, then the program is over, and all of a sudden the violence returns. And there's been challenges with relations with the police. So these are not police officers, these guys, right? And the police in some of these cities have a real difficult time accepting the fact that these folks are going in and trying to disrupt these networks. And so that has challenged the program from proceeding. This is just some findings from New York City, very briefly. And you can see that in northern New York, for instance, in Brooklyn, the effects of the program are in light blue, and there's a match comparison neighborhood in dark blue. You can see how much more of a reduction there was in the treated neighborhoods compared to the untreated neighborhoods. This is taken from Jeff Butz's work at John Jay. However, in southern New York, in Brooklyn and so forth, there really isn't much of a difference. So you can see in some neighborhoods it works, in some neighborhoods it doesn't. Another favorite program of mine that's going to be published this month in the American Journal of Public Health, and all of you can look at it, really interesting. In Richmond, California, took 30 youth, so this is all carrot, right? Took 30 youth who were, the police deemed most responsible for the vast majority of gun crimes in Richmond, California, which is not a massive place, and they gave them cognitive behavioral therapy. They took them on excursions, including a trip to Europe. They gave them mentoring. They gave them social services, and they gave them $1,000 a month in stipends. Jen Ahern just finished this evaluation, and there's a 43% reduction in the violence for the city overall with the institution of this program. It's really, really impressive to think about this, and you can see the difference between what was expected to happen and what actually happened. Quite a reduction, really, really impressive, this Operation Peacemaker work. So sometimes these things really do have quite an impact. Now, something that mixes carrot and stick that has been going on for a longer time is this focused deterrence opportunity, where there's a blend of both policing and community mobilization and social services. And it has had impact, and the focus here is usually, again, on a very, very specific group of folks, usually gang members. It has had an impact in improving and reducing violence. So you can see favoring the treatment on the right side. On average, these programs do favor the treatment, so it has impact. But again, it's not working in all cities as much as we'd like it to. And has other issues in that the program has had initial amazing successes, but became more stick than carrot as it evolved over the decades, and has led to some challenges for the communities that, sometimes in some of the communities that it's in. And then, of course, we'll get to, and I would just want to mention policing, because when you think of gun violence, it is the first thing you think about is a police response. And in fact, policing works. Yeah? So this is an early piece that was done in Kansas City, the Kansas City gun patrol experiment, where they created specific police units that would, basically this was a stop and frisk campaign in the early 90s that was walking around the city of Kansas City, and you can see the difference between when they had the patrol and when they didn't. The patrol had pretty much over 50% reduction in gun violence for the city. Now, in the target beat, meaning the one that was treated versus the one that was not. Now, while this does work, reviews of it, Anthony Braga did a review of this, it works, but as we all know from following the news in the past decade, sometimes these things can become overly aggressive, these sorts of policing strategies, and citizen complaints go up about all kinds of things, police misconduct, abuse of force, and legitimacy. So this is not me saying that we should in any way abandon the policing strategy, but we need to be very careful about how we use our all-stick strategies like policing on reducing gun violence. Now, the other thing I'll get into is thinking about programs that focus on high-risk individuals versus population-based programs. Now, high-risk individual programs have advantages. All the programs I was just telling you about are all high-risk programs, right? They're focusing on people who are at greatest risk, and if you can get to them and make a difference with, could be policing, could be interrupters, various things, you will have a change. And indeed, there is impact. But we also need to think about larger, what Jeffrey Rose and Len Syme, when I was at Berkeley, Len Syme is the father of social epidemiology, right? What Len called population-based programs or universal programs. That is, programs that protect everyone in the community and that aren't focusing down on select individuals, and they have several advantages. One is, there's studies like this all over. This is one, this is actually from London, that police work, right? So you can see the level of crime going on, right, over time. The insertion of police patrols, crime goes down, but then what happens once the police patrols are pulled out? Right? So the crime returns to the pre-police levels. So police in these sorts of high-risk programs do work, but they only work as long as the program is active in the community. And for many of these programs, it's difficult to sustain the program. So one of the things that we've been thinking a lot more about, this comes from my work in a number of cities, but starting at the University of Pennsylvania and now at Columbia, are place-based solutions. These are population-based solutions to think about actually changing places to reduce gun violence. And in the words of the CDC, this is, quote, making the healthy choice the easy choice. And when you think about this, this is an early, and Carol will remember this, this is an early piece from 1981 by Susan Baker at Johns Hopkins, where she was talking about the probability of success of a program is inversely related to how much you ask the people who would benefit from the program to do. The more you ask people to do, the chances of the program actually succeeding and having an impact and improving their health is less. And I would argue, so when you look at gun violence in the US, deaths from guns have remained pretty steady over the past 50, 60 years. Yeah, the red line. But motor vehicle deaths have gone down. The rate has gone down and the numbers have gone down. Yeah? Why is that? Part of the advantage is that changes were made to our roadways, the roadway environment, the places that we drive, and the car environment, things like airbags, and that these are more up this curve, these place-based opportunities, whereas things like driver education have had impact, but perhaps it's more challenging to have an impact and have program success with them. And I have to say, my daughter will appreciate this. We just drove here from Boulder in my father-in-law's new Lexus, and I put it on cruise control and never touched the brake or the gas, and the car slowed and accelerated on its own. I didn't even know it, actually. I noticed it, and I said, wow, this is kind of cool. And it kept a perfect distance from the car in front of me and so forth. So these sorts of environmental, what are called default strategies, where you're not asking anyone to do something, yet they are receiving the protection of the program, are things that we really need to think about. Now, for gun violence, there are a number of very successful place-based programs and solutions that have been studied and studied at the absolute highest level scientifically. I mean, with true experiments. This is one that was just published in New York City, the New York City lighting experiment, where temporary lights were put up in affordable housing with the New York City Housing Authority. Now, you can see an example of a light, right? It's really, it's an oppressive amount of light. So these were temporary like tests for an experiment. But there's a really impressive reduction in crime and violent crime that occurred in New York City housing, in and around New York City housing, when the lights were on, as opposed to spaces where they were not. That we're trying to figure out, Aaron Chalfin is the one who did this with the crime lab in New York City, and there were, of course, a lot of concerns, community concerns about the brightness of the lights. So they're trying to figure out alternatives to the lighting, but it does demonstrate that changing the place in terms of lighting can have a significant impact. And again, at the highest level. So this is a true experiment, true randomized controlled experiment. Work that we've done in Philadelphia, where and this is I think what Carol was alluding to a little bit, where we've taken abandoned lots, abandoned land, and abandoned buildings. Now we have another trial going on abandoned buildings, and converted them. For the land, we've cleaned and greened the land for very, very little money. For the buildings, the building gets cleaned with new windows and doors. Again, very, very inexpensive. These have shown as much as a 39% reduction in gun violence. And I will say, again, speaking to the human-oriented programs like policing, it's not that we want to offset them, but these sorts of programs will maintain and have sustained reductions in gun violence. In some cases, we've shown it for years to come, and citywide. for several years. And they are incredibly inexpensive. The lighting is also incredibly inexpensive. So for every dollar you invest in this, of course, gun violence is a very expensive disease to the medical system, to the law enforcement system, and in terms of pain and suffering and so forth. So the return on investment for these very inexpensive treatments is quite high, something in the hundreds of dollars for these sorts of things. And we are, these experiments for the land and the buildings in Philadelphia are the first citywide experiments of their kind, where we've picked, it's actually closer to about 1,000 properties in the city. There are about 50,000 abandoned properties in the city of Philadelphia. We picked about 1,000 of them randomly. If you take cities across the nation and the abandoned properties for those cities and the space they represent, it is a land area the size of Switzerland. So there is a massive, massive opportunity of millions of properties that look like the properties on the left side of the screen here, okay? A massive opportunity, and we randomly assign them to 3 different groups to get the full treatment, a group that just gets cleaning and maintenance, and a group that doesn't get anything. Everyone gets it at the end of the treatment. And actually what we're finding for the fully treated group is that things like, well, crime goes down by a significant amount, but so does gun crime, shootings and gun assaults, yeah? But other things do too. Burglaries and particularly nuisances, things like public drunkenness, noise complaints, and other sorts of disorderly conduct also go down after you treat the spaces in that neighborhood. And we usually do them as clusters of like 5 different spaces, something like that. Not everything goes down. So it was actually, we were funded by the National Institute of Drug Abuse to look at this for illicit drug trafficking, and that was not affected in the city of Philadelphia. It was in other cities. But gun violence is very much affected by this, partly because those spaces, those abandoned spaces, are what the police call storage lockers for illegal firearms. So believe it or not, folks who are engaged in illegal activity or have illegal businesses are business people just like anyone else. They are not, actually, for the most part, users of their product. They want to keep a clear head, and they have a margin to deal with, profit margin to deal with. So they also often have priors. Maybe 50 to 60% of them have prior arrests and can't carry a gun with them. And interestingly, this was done with anthropologists who lived in the neighborhoods for years as part of this trial. Interestingly, they know the risks that firearms pose to their kids and their family, and they don't want the guns in their homes. So they're left with these open spaces in the city to store the guns, and once you remove that opportunity, it removes the weapons from the spaces and has a significant effect in reducing gun crime and gun violence in the areas. Okay, so all told, I don't want to dwell on place-based experiments, but everything, these sorts of things, when you take them all, whether it's greening, changing buildings, lighting, adding trees, there are a number of cities that are now engaged in this or have already been engaged in this, and they're seeing anywhere from 6% to something like over 50% reduction in gun violence and crime. And I am going to put a nod to Chicago and the folks at the University of Illinois, different folks than the Cure Violence folks, who did the first studies here on this of comparing affordable housing with trees and without. And the latest work that we're doing right now in New Orleans, you can see one of the lots that we just did a couple months ago in New Orleans and the difference in that. And of course, it poses completely different challenges to Philadelphia. Well, stuff grows much faster in New Orleans year-round, and we've had to adapt the intervention to deal with snakes that inevitably live in the spaces. So it's been very interesting, and I hate snakes. My daughter knows that too. All right, so let's talk about firearm violence as disease. So we penned this months ago, this piece in JAMA Internal Medicine, where I, Sarah Jacobi, and Elena Andreeva titled it, Firearm Violence as Disease, Hotspots are Hot People, to look at this in response to a piece by Green et al. And they were looking at networks. How does gun violence proceed on a network? And we're using the same modeling, mathematical modeling tools that we use for infectious disease spread and the propagation of infectious diseases. And they found an incredible relationship, right? So this really put it down to me, and I'll show this again in a second. But is there value then in thinking about this as disease? What do we get out of that? And I know there's a long history in public health of trying to get away from thinking about it as disease and as a pathology. And there's value in that too, but where has that gotten us? And I'm hoping we're having a discussion about that a little bit more. Now, part of the challenge here is that we're living in a very divided country, right? Red and blue America. Everyone's seen this map. So in red and blue America, guns are contentious, of course. They're seemingly intractable. So many times when you talk to people, whether they're on the right or the left, there's so many of these out there that people will just throw their hands up. It's as if it's endemic and there's nothing we can do about it. There's little recognition, period, of gun violence as a health issue, much less a disease, biomedical, or epidemiologic issue. And this schism has led to really a lack of scientists and a lack of scientific resources to begin to think about this the way we have created a moonshot that affects an entire cancer center here. There's no such thing. And I'll show you in a sec. There's no such thing for gun violence. Now, people not willing to listen to the other side, this is a top 3 issue in the U.S. In fact, it is now a top 2 issue. We did this analysis in 2005, and gay marriage has fallen down on this list. Guns are now a top 2 issue with abortion in terms of when you ask people would they be willing to compromise their values and consider something that the other side is suggesting, they are by and large unable to do so. And this breaks down to and this I guess won't be surprising, into a city versus country disagreement. What sociologists call urban cosmopolitans and rural traditionalists. We did a study long ago that actually the Supreme Court used in talking about the variety of gun violence across the U.S. And what you see here, putting every county in the U.S. from counties like big cities like New York, right, are number 1, all the way out to small towns. Like Denver is like a number 4, not Denver, Boulder is like a number 4 or 5. Denver is a number 2, I think, on this list. But you're getting a sense all the way out to our smallest towns, and the rate of gun violence is very different. And some things were very surprising about this. The one thing that most people notice about this first is that the rate of gun suicide in our smallest towns in the United States exceeds the rate of gun homicide in our biggest cities. And I'll come back to this in a second, but this illustrates this difference between big cities and small towns, which is leading to a lot of the challenge in moving forward on this issue. Now this is a meta-analysis of a series of epidemiologic case control studies that were done from the 90s on the relationship between owning a gun and experiencing gun violence, various gun violence outcomes, yeah? So owning a gun and experiencing gun violence, and on average, the risk is higher and statistically significant across all of these when you pool all the different findings here. Now, we had one of actually the most recent one in this list, looking at possession of a firearm and being shot with a gun. And in fact, this meta-analyses grade studies and do adjusted depending on the quality of the study. And we were best in class, I'm happy to say, in this, right? So the relationship between possessing a gun or owning a gun and being shot, yeah? Now, this didn't stop the NRA from taking notice, and I will say the study was in 2009, right around the time the Supreme Court was debating landmark decisions in the Heller decision and so forth on the Second Amendment. But it didn't stop the NRA from saying gun ownership as disease reaches fever pitch, gun ownership as being labeled disease, and only treatable as a public health menace. So I want to ask you first thing, what's wrong with this? Brilliant. So this is a fundamental misunderstanding of the studies we did, right? So we never said gun ownership was disease. We were looking at a disease outcome, or even an outcome, which we didn't even label disease. Yes? Well, correct. And you'll notice diseases in quotes. They called me a scientist in quotes, all of that. So, you know what? I don't know, Don, to be honest with you. And I think it could go either way. I think you're very right. I mean, much of this is very much intentional. This was in the American Rifleman, which goes out to their 5 million members. So this was the lead story at the time and generated a lot of backlash. But I want to show you the other side very briefly. So this is the Guardian's response. So the Guardian is a UK, very progressive, left-based paper in the UK that says guns don't offer any protection, whatever the National Rifle Association says, which, frankly, I don't agree with either. If guns didn't offer any protection, this would be, well, this would be like the UK, right? Our police would not be armed. So there's value to firearms. It's not as if there's zero value to them, and the eradication of firearms isn't really on the list. So no one said gun ownership was disease, so you got that. I'm so pleased. But is gun violence? Is it worthwhile to think about gun violence as disease in this very split political environment? So I will make two arguments. So the one of why it's disease. So gun violence is successfully treated with medical care, frankly, as a disease. Yeah? So trauma surgeons train for this stuff. Yeah? The military medical people who are replete on this campus apparently train for this stuff, right? And we know through really strong science, this was done at Johns Hopkins in the 90s, that if you are shot and you get to a trauma center in a short period of time, your chances of surviving go up. Same way if you get to a cancer center, your chances of surviving go up for certain cancers. So there's this issue that it's not simply a justice or a police response. So the medical system is involved here. Frankly, the medical system is involved whether you survive or not. If you don't survive, you will go to a medical examiner or a coroner at a morgue, and that is also part of the medical and public health system. So the other thing that has been very interesting to watch happen, and I think have all of you seen this, I'm not telling you anything you don't know, is the NRA sent this tweet, I guess it was last year, where it told doctors to stay in their lane over gun violence and gun policy. And there's been a huge backlash on this to the point where an entire medical society, a firm, has been created. I don't remember what a firm stands for. You should Google it. It's a wonderful organization which brings together the AMA, the American College of Surgeons, the AAP, and various medical societies all together to say that they're not going to stay in their lane, that they think that there's value to the medical and biomedical system in terms of treating it, and that medical providers are right there on the front lines for this. So the other thing I will say, just as to go back to the earlier thing I was talking about with Green and colleagues, the article they put in JAMA, that gun violence can spread and be prevented like other diseases. We know that not just from that study, but from a number of different network studies and diffusion studies. So in the same way that you can imagine a host agent vector environment, I'm talking to the epidemiologists in the room a little bit here, for malaria or dengue, gun violence functions in the exact same way. You can focus on the host, the agent vector and environment, and disrupt and interrupt the process of the disease. Now, two things that have challenged this. Ted Alcorn put this piece out looking at, it must be decades and decades, maybe 30 years of publications on gun violence, scientific publications on gun violence, which are the blue bars in this. And what you see in 1996 is this thing called the Dickey Amendment, which was put onto, just as the Centers for Disease Control were beginning to recognize this as a public health issue, a public health and biomedical issue, the Dickey Amendment appeared and was this rider of language that had to be on every grant application that went out. And so it said you couldn't do, it didn't ban, it didn't make it forbidden to do gun violence research, but it was pretty ominous language. And it really discouraged folks. It was in response to a couple of different CDC grants that had gone out that were not in any sort of violation, frankly, of the language. But what you see is this intense drop-off in the ensuing period after 1996 of academic publications relating to gun violence. So that's been a real issue. And it's effectively led to an entire generation of potential scientists that have been lost, who could have been doing gun violence research, but chose to go into something else because it was just less of a hassle. You didn't have to get the gun lobby, would not be in your grill about this all the time, and it was just easier to go research cancer or cardiovascular disease. The other thing is, over decades, there's been a massive lack of research funding, despite, this is a letter that, this quote at the top is a quote from the NIH director, the current director, Francis Collins, that admitting, but it took some cajoling, but admitting that the battle against illness and disease can't be limited to biologic factors, but must also include causes such as firearms. Now, the NIH is the biggest scientific funder on the planet. No one gives out more scientific money for research, and things like cholera, polio, and rabies here, for the number of cases of these, perhaps you get, for cholera, it's one major grant, this is over 40 years, one major grant for every 2 cases of cholera, and you can look at the other numbers. For gun violence, it's a massive. Over that same 40-year period, it was one major grant per million cases of gun violence per decade. So this is a massive, disproportionate underfunding of this giant problem that we're having in the U.S. with about 100,000 shootings a year, a million a decade. Okay, so massive disproportionate underfunding. And so the only way, and I'm going to conclude and then we can talk a little bit, the only way we're going to get beyond red and blue here is really to think in more purple terms, right? But Purple America recognizes that gun violence is a public health problem of constitutional significance. There is not another public health problem that has a constitutional amendment to wrestle with. So this is a particular challenge for us as public health providers and as medical providers to begin to think about what that means and how we recognize that, get the public to recognize that, get policymakers to recognize that, and move past it. Purple America also invites nonpartisan solutions that are shown to work scientifically, things like laws, certain laws when there's an opportunity for that, as well as things that are reasonably inexpensive and can be sustained, like some of the place-based solutions I was showing you just now. And then we must resource the scientific study of gun violence at the level of other diseases if we're going to have the impact, the moonshot-like impact on this important challenge for the U.S. I like to think, with a lot of the Obama administration in response to some of the mass shootings, particularly Newtown, came up with some goals about how much money they wanted to put forward, and it was things like $10 million over the course of a decade, something like that. That's completely inadequate. I'd love to see something like $100 million over the next 3 to 5 years. And we are moving towards that. There has been recognition, particularly at the NIH, that this needs to be invested in. And the NIH actually put out a few years ago, for the very first time, program announcements, grant program announcements, that use the word firearm in them. Much to then those were challenged in Congress, but they remained. So that's a very big deal. So last thing I'll say is, urban cosmopolitans and rural traditionalists, the red and blue that you see here, I'll go with the purple theme, and I have to credit Mike Nance, who is a co-author of this with me at Children's Hospital in Philadelphia. Mike pointed out to me that if you add the red and the blue, you get this roughly flat line across the top, across big cities and small towns, which the real message here is not the difference between them. The real message is that gun violence affects us all, and we all need to be in this together to make a change. So thank you very much for the opportunity to speak with you today. And any questions? Yes, sir.
So we see an association between violence and levels of.
Yeah.
Any research
It's a good question. When I showed you the 4 funded studies, which are now 7 at the NIH, so when it was 4, we had 3 of them at the University of Pennsylvania on gun violence. The 4th one, though, was the actual first NIH-funded study, and it was a study of lead poisoning from retained bullets. So I have not seen a study of, so your question is more about lead poisoning from perhaps a young age and the aggressive tendencies that might emerge from that. I have not seen that, and I think it would be really, really interesting. There's been a couple of things, people dabbling in the administration of omega-3s and fish oils as an opportunity to reduce aggressive behavior in children, teens, and adolescents, and perhaps that would reduce gun violence. But I think that's a very worthwhile thought, to imagine it as perhaps even an environmental place-based change, the reduction of lead in spaces and cities and so forth. Go ahead.
This kid.
There have. Oh, interesting. Well, those child access prevention laws that have been successful, the most restrictive of them prevent kids from handling a firearm at all. And there are real restrictions. Like Massachusetts has a really strong, even going to a range. So people will bring their kids, you guys know this already, I'm in Colorado. People will often bring very young children to a range. I've seen some really, really problematic choices by parents bringing like 6, 7, and 8-year-olds to a range to have them shoot for the first time. If you talk to people who own the range, there are specific ranges in certain cities, shooting ranges, that have filters for the lead that are supposedly child-friendly. Like if you talk to police officers, they will direct you to the right range if you wanted to bring a child. So there is certainly some literature on it and a practice-based challenge for lead in the ranges. Yes?
So thank you for your
Yeah? Cool. Yeah. Mm-hmm. More what in schools? Mm-hmm. Hmm. Yeah. Yeah. Mm-hmm. I'm so sorry to hear that it's not, right? So that it should be, and there should be a list of things, including officers in schools, right? Including, and now we are embarking on a school violence study, and we want to really begin to look at, well, mass shootings in schools and what may work and what doesn't. There's been nothing really that has been done on this, and it's led a lot of jurisdictions in the state of Pennsylvania, for instance, and in Missouri to begin to do things like arm their teachers. And that is going in the complete opposite direction. That's not even putting uniformed officers with weapons in the school, or some other metal detector or some other sort of environmental thing. That's going in the complete opposite direction with zero evidence that it works. And probably the likelihood is, if you logically think it through, asking a kindergarten teacher, I don't know if any of you have kids or have spent time in a kindergarten class, it's a pretty chaotic environment. Already that teacher has enough to do, much less having time to also appropriately train and use a weapon if there's any kind of issue. So, these sorts of things, they've gone in the wrong direction, and you're right. There's not enough thinking about the weapons themselves and getting into the homes and trying to teach people who perhaps shouldn't have them, things that you're labeling gun control. But I think all of this needs to be put on a menu, and we need to start thinking about testing these and which ones work. Have any of you heard the Stop the Bleed campaign? So Stop the Bleed campaign is an attempt to train civilians so that if someone is hemorrhaging, it's basically an attempt to train civilians on how to control hemorrhage on up to use of a tourniquet. The Stop the Bleed campaign, there's mixed evidence whether it actually works. However, so it may work, and I know some very prominent trauma surgeons that have pushed it, and I trust their judgment. But on the other side of it, I talk to pediatricians and school officials who are very concerned about exposing children to the training itself. Like, what would be the adverse mental health effects of having kids, teaching them and showing them different sorts of, tourniquet, people hemorrhaging and so forth, even in simulation. I think that's very challenging. But that's on the list as well, and we don't know. So what are the implications? Will it actually be effective? And what are the unintended consequences of this in terms of adverse child experiences that on down the line? So there's a lot of work to be done on this, and I know that municipalities and epidemiologists in the field like you want to charge forward and got to do something, right? But we really need to start thinking about this and putting everything on the menu and trying to figure out what works and what doesn't in a rapid fashion. And again, the federal government, state governments are not putting the resources forward to do that. Yeah. Yes.
In the context of your
Yes. Uh-huh. Yeah.
So do we
Mm.
bonds among the people?
So you're talking about, this is Dylan Klebold's mother, right? Well, I actually had the opportunity to sit next to maybe last year at a meeting that was organized by the National Mental Health Association. I think there are opportunities, so I'm going to answer both your questions just a little bit. And I am, not everyone agrees with me, but I think there are opportunities with mental health and to begin to think about mental health and screening out folks who should not have firearms, and if there's anyone in the family that has certain challenges. Now, I don't know the details of that, and that needs to be played out. And this issue has been it's been a disagreement in the public health community, frankly, and a rightful disagreement where gun control advocates and folks who want to reduce gun violence may favor restrictions for folks with mental illness, whereas folks in the mental health community may not, because it's going to cause stigmatization and encourage people not to seek care when they need it. So there's this trade-off in mental health. But I think the discussion sitting next to Sue, right? Yeah, it's sitting next to her. I think it was something that this group came to, that we need to begin to have more of an open conversation in terms of mental health and what opportunities are there for owners and for families in terms of weapons being around and what folks should be just prevented from having them. Now, your first question was about informal social control, right? So informal social control, it's interesting. So our work on place-based solutions to gun violence is predicated on informal social control in a lot of ways. It's not asking anyone to do anything. It's changing the spaces, and people begin to informally police a new space. I can't tell you, having seen this now hundreds of times, when you clean a space and create order, people do not want it to revert to the prior space. So they will spend extra time doing things like telling folks who are making noise or doing disorderly conduct on the space to please move on and stop doing that. So it in and of itself creates informal policing, or actually what the actual police in many cities call soft policing of the spaces, and we think it's one of the main mechanisms, in addition to the illegal guns in the spaces, it's one of the main mechanisms that causes the gun violence to go down. So I think informal controls and default strategies, nudges like this, that change these spaces have real value in moving this forward and have more sustainability than always waiting for the event to happen or doing it in a more risk-based approach. More population-based informal controls have great value. One more? Okay, this guy. Yeah. Yeah, a person always asks that. That's the hard question. Thank you for asking it, though. And I did talk about suicide, which I think is a major issue and a growing issue. It's the growing gun violence issue in the United States. The answer right now is I don't know. I will tell you we've been thinking a lot about issues frankly, of loneliness as a public health issue. Has that made the minds of the folks here at the School of Public Health? So our School of Public Health at Columbia has been thinking a lot about this and the implications of that and how to bring people out of isolation, because many of these shootings are really the underpinning of it could be mental health issues, but oftentimes is being outside of a social network and the health value of a social network. So how can we engineer a social network? In the UK, it's pretty fascinating, which we've been talking to them. The UK, just like we have the Secretary of State and the Secretary of Defense, they have ministers, right, of these sorts of things. They have now created a minister of loneliness. True. In the UK, right? So someone who is really, their charge is the recognition that loneliness is a leading health issue for the nation, and they have been thinking a lot about suicide and the implications there. And one of the more creative things that they've come up with that I would love to see expanded here in the US, or at least tested, is use of the Postal Service and delivery services. Because these, or other human-based services that are already there, which are a pseudo-default, that could check in on folks on a regular basis. I mean, Amazon delivers to many people in very, very remote locations, as long as it's not a drone. It could be a person who steps in and says, and just checks in on folks, if they could be trained to begin to recognize things like that. So I don't know what the equivalent default solutions are for our rural areas yet, but your question is super important and one that we need to really think about over the next short term, 5 years and so forth. So thank you for that.
To thank Charlie, but before you give your thanks, just this session was video and audio taped, and for the students in the audience, there are a number of investigators on this campus who do work in the, who are interested in following that. Contact with the paper programs. And Eric Siegel, who was here for me.